Hello everyone, I'm Jeffrey Snook Cosgrave with the West Lab, and today for Callaway's class, I really wanted to talk about induced neurostem cell therapy, mainly getting into some stem cell background as well. Before we get too starry-eyed about the promise of stem cell therapies, I think it's very important to acknowledge the controversy that has surrounded this field, especially in its early years. A lot of public backlash stemmed from the use of fetal or embryonic stem cells, which we will talk about here in the next slide. Fetal versus embryonic stem cells. So embryonic stem cells are derived from early stage embryos or blastocytes and are pluripotent, meaning they can differentiate into any cell type. We will talk about this more in depth in some future slides. While fetal stem cells are obtained from fetal tissues, such as blood, bone marrow, or other organs, and are multipotent, meaning they can differentiate only into a limited range of cell types. Now, the use of these cell sources has raised ethical and religious concerns. Many people objected to the destruction of embryos for research purposes, especially when fertilized embryos from IVF clinics were involved. This sparked intense debates in the 1990s and early 2000s, particularly in the US, where we currently are. And in the US, funding for embryonic stem cell research became a political issue. There was also concern that the government funding and scientific endorsement of such research might pave the way towards morally questionable practices like cloning of human embryos. As a result, public perception of stem cell research became polarized. Some saw it as a life-saving science, while others saw it as ethically problematic. Enter the beauty of the induced pluripotent stem cells, or iPSCs. iPSCs really changed the game. iPSCs offer the same pluripotent capabilities as embryonic stem cells did, but without the ethical baggage. Instead of coming from embryos, iPSCs are made by reprogramming adult somatic cells like skin or blood cells back into stem cell-like state. We'll talk about this in the future slides as well. With no embryos involved and no destruction of potential life, this was a huge relief for both the scientific community and for those with ethical concerns. What's more, iPSCs opened up the possibility of personalized medicine, since the cells could be derived from a specific patient, reducing the risk of immune rejection and eliminating the need for controversial sourcing. In fact, the use of iPSCs has helped rebuild public trust in stem cell research. It's a great example of how scientific innovation can actually respond and solve ethical dilemmas rather than just ignoring them. So you may be asking yourself, what exactly does pluripotent mean? So when I say a stem cell is pluripotent, I mean it has the ability to turn into almost any cell type in the human body. Much as you'll see in these figures, they can turn into nerve cells, heart cells, or even skin cells. It's incredibly versatile. The only thing it can't become are the cells that form the placenta or the entire embryo itself. That's what we would call a totipotent cell. What makes pluripotent stem cells so valuable, especially in medicine, is that we can guide them to become exactly the kind of cells we need for repairing damaged tissues. And that's exactly what we're doing with iPSCs, taking adult cells, reprogramming them to become pluripotent, and then using them to regenerate specific tissue. Now for this presentation, and specifically because it's what most of my background is in my lab, I do want to focus on the neural lineage of neural stem cells. If you've seen this image here, the neural lineage would be this neuron, and that's not the only thing that induced neural stem cells can differentiate into. But that's just a good example that I found with this image. Now, when I talk about induced neural stem cells, what I'm talking about is induced pluripotent stem cell derived neural stem cells. And these are often used to treat neural injury. And just to give you guys an idea of exactly how that's done, this is a little bit better of a diagram for helping explain this. But we can take a human, and in my lab, it's often a human that has a traumatic brain injury, and we can take adult cells. Oh, grab my little pointer actually. We can take adult cells from them, and then through reprogramming factors, we can start to induce pluripotency to create induced pluripotent stem cells. Now, the reprogramming factors, essentially what you're doing is you're reversing the steps that the cell took to mature into, say, a neuron for this example, or a neural stem cell. And you're reversing those steps back into where it becomes an induced or a pluripotent cell. And since we did this with reprogramming factors, they are induced pluripotent stem cells. From here, we can then differentiate these iPSCs into neurostem cells. That would be our induced neurostem cell. And then we could transplant those cells back into the patient that needs them, meaning that they're patient-derived as well. A really exciting opportunity. Now I'd like to talk about some FDA-approved treatments using induced neurostem cells in humans. Unfortunately, there are no FDA-approved treatments utilizing iNSCs for humans. Much of the work involving iNSCs is still in the preclinical phase, meaning that it hasn't even reached human trials. Researchers are still evaluating their safety, potential for tumor formation, efficiency in converting cells, and integration into host tissue before moving into human trials. And just to touch on that tumor formation a little bit, uncontrolled cell growth is technically cancer, and that is a risk we're running and still trying to solve with induced neurostem cells as well as iPSC cells. While there are many ongoing studies exploring cell therapy for neurological condition, therapies using iNSCs have not yet reached the stage of FDA-approved clinical treatments. Early-stage clinical trials may be in the planning or executive phase, but FDA approval requires a robust body of evidence showing safety and efficacy, which has not yet been established for iNSCs. Although iNSC-based therapies are an exciting area of research with potential future applications in regenerative medicine and neurology, there's currently no iNSC treatment that has met FDA's stringent requirements for approval or clinical use. So much of what we know about iNSCs comes from animal models. Now, I think it is worth mentioning that one treatment utilizing human iPSCs has actually made it to human clinical trials, and this was in the great country of Japan, where they actually use iPSCs to treat an eye condition known as limbal stem cell deficiency, or LSCD. Now, this disease happens when stem cells located at the limbus, which is the border area between the cornea and the sclera, are either lost or damaged. And these cells are crucial for maintaining and regenerating the corneal surface. Without them, the cornea becomes cloudy, scarred, and vascularized, leading to significant vision impairment or even blindness. Historically, treatment options have been limited, especially for patients with bilateral LSCD, and this is where the use of iPSCs becomes a major breakthrough. Japanese researchers found that iPSCs can regenerate corneal epithelial cells, and these iPSCs can be derived from the patient's own somatic cells, like we've already mentioned, and then reprogrammed to differentiate into limbal-like cells, which these cells are then transplanted back onto the eye to rebuild the corneal surface. What's especially exciting about these, though, and a major reason why they were actually used in these trials, is that these iPSC-derived cells don't just replace damaged tissue, but they also help reduce inflammation. So in LSCD, the eye is often in a chronic state of inflammation, which further damages the tissue and impairs healing. But studies have shown that iPSC-derived epithelial cells can exert immunomodulatory effects. Essentially, they secrete anti-inflammatory factors and help restore a more balanced microenvironment on the ocular surface. And this can lead to reduced redness, less pain, and a more stable surface of the cornea for healing. Just thought that was really worth mentioning, as this is a huge breakthrough, and it just reached, or the paper was just published in 2024, and it's the first human trial using iPSCs. Now, since we have mentioned that iNSC treatment has only been looked at in animal models, I think it is important to point out some of the benefits that they have provided. They have a major therapeutical advantage because they're a multimodal therapeutic capable of providing neuroprotection, enhancing regeneration, and functioning as cell replacement. And in this paper by Peng et al., they actually utilized induced pluripotent stem cell derived neurostem cells. As we can see here when we look at our figure, we have our number of apoptotic neurons, so our neurons that are dying on our y-axis. On our x-axis, it's covered up by my face, but in black here we have our TBI group, and in gray we have our neural stem cell transplant group. And we can see that our neural stem cell transplant group has significantly reduced number of apoptotic neurons compared to our group that just received a TBI and no neural stem cell treatment. I'd like to continue on looking at some figures from Peng et al., but I believe that it requires just a little bit more background. So an induced neural stem cell is able to differentiate into all three neural lineages. And just to give you an idea of what those are exactly, that would be our neuron, of course, which is, I think, the well-known player that everyone thinks about. But it's also able to differentiate into astrocytes and oligodendrocytes. And astrocytes and oligodendrocytes would be glia cells, where the neuron is not a glia cell. Peng et al. Was able to show that their transplanted neurostem cells differentiated into neurons. And this graph may look a little confusing, but I'm going to walk everyone through it. So in A, we have our green fluorescent protein positive cells. These are cells that they actually transplanted into the animals. We have our DAPI stain, which are stains for our nucleus of the cell. And then moving on to C, we have our TUJ1, which is actually a neuron marker. So we can see our neurons that are present. And then when we merge them or co-localize them together, we can actually see our transplant-derived neurons, such as what this arrow is pointing out right here. And again, this is in Peng et al. Using neurostem cells in a rodent model. Now that we've already learned that neurostem cells are able to differentiate not only into neurons, but also into glia cells, such as astrocytes and oligodendrocytes, Peng et al. Found that also to be true. Again, looking at E, we have our green fluorescent protein positive cells. We have our F, we have our DAPI, which is again our nucleus marker. And then in G, we have our GFAP, which is our astrocyte marker. We can actually see our astrocytes right here. They've got that beautiful spiderweb look to them. And then in H, when we merge them all together, again, we can see our transplant-derived astrocytes. Now, I know we just talked about Peng et al., which utilized a rodent model. However, I want to get into my research just a little bit, just to touch on it, as this is a topic I've looked at a lot. And I utilize a pig model, if you will. And this is because an analysis of hundreds of unsuccessful clinical trials resulted in the recommendation from a number of workshops, including industry partners, the government, and academics, recommending to test novel therapeutics in large animal models with gyrocephalic brains. Now, this recommendation comes because of the translational gap that exists between rodents and humans. And the pig is a really unique animal because it helps fill this translational gap. I'm just going to walk through this. This would be a rodent brain. And as you can tell, they are smooth or lysocephalic, if you will, where the pig brain and the human brain have those wonderful wrinkles that make them gyrocephalic. Now, the rodent brain is also only around 12% white matter, where the pig brain and the human brain have a very similar white matter ratio. And I know this probably goes without saying, but the size difference is actually absolutely incredible between a human and a rodent, as well as between a human and a pig. Just to give you an idea, I mean, you guys can do the math yourselves, but these numbers are pretty easy to digest. So the pig does make a great gap, or help us bridge this translational gap. Now, I know I'm kind of running with some of the background from Peng et al., but I wanted to go through a figure from my own paper where we were also able to show that iNSCs showed long-term survival, engraftment, and differentiation to all three neural lineages, being neurons, astrocytes, and oligodendrocytes. And this figure probably looks a little confusing, but it's a lot easier to think about or go through than you would think. It's actually three figures that are sewn together, and we'll walk through those really quick. So in A1, we have our DAPI in blue, and then we have our H&A, which is our human cell marker, in green. In A2, we're going to have our DAPI in blue, and our NUIN, which is our neuron cell marker, here in red. And then when we co-localize them all together, we can see our transplant-derived neurons. Moving on into B, we have our DAPI, our B1. We again have our DAPI in blue and our HNA in green. Moving on into B2, we again have our DAPI in blue and our GFAP in red, which is our astrocyte marker. And then when we co-localize them all together, we can see our transplant-derived astrocytes. And then moving into our final portion of this figure in C, we have our DAPI again in blue, our HNA again in green, and then in C2 we have our DAPI in blue and our OLIG2, which is an oligodendrocyte marker, here in red. When we co-localize them all together, we can see our transplant-derived oligodendrocytes. Now, I know we mostly went through preclinical research on this topic as there is no approved human treatment for it, but in the end, using iPSCs to generate induced neurostem cells isn't just a scientific workaround, it's a transformative strategy. It combines the power of personalized regenerative medicine with the ethical clarity that iPSCs offer. By harnessing a patient's own cells to create neurostem cells, we're not only reducing the risk of rejection and inflammation, but we're also opening the door to safer and more targeted treatments for devastating neurological conditions. And if you're in the West Lab, that would be traumatic brain injury. It's not just a promising approach, it's the future of neuro repair. And with that, the foundation is laid, but a lot of research is still needed to make this possible for humans to use. And I want to talk about that a little bit in the next slide. So if this is a topic that really interests you, or if it's something you really care about, there are opportunities at UGA to help explore this a little bit further. There's master's options and PhD options. Some great people to reach out to about doing a master's or PhD would be Dr. Frank West or Dr. Aaron Kaiser, and I've put their emails down here as well. And if you're an undergrad, you can still get involved if you're not looking at doing grad school. Dr. West and Dr. Kaiser are always looking for undergraduate researchers, and I believe this does help get you some large animal hours for vet school applications if that's something you're looking for. There are also classes available that Dr. West teaches as well as Dr. Kaiser teaches. I believe Holly Kinder might have a class that she teaches as well that might be in the field. And then if you're looking to make a little bit extra money to help be involved with this as well, the LaRue, or the Large Animal Research Unit, which is actually located in the building that we take our class in, is managed by Terry Parker, and you can help take care of the research animals and earn a little bit extra cash. I know her email is cut off here due to my face, but it's terry.parker@uga.edu. And so if this is something that interests you, feel free to reach out and don't be afraid to tell them I sent you.